It is inevitable that the human lens will change color with age, and there will come a time when it has to be replaced. We are all aware of the glistenings in alcon lenses, but few of us have heard about subsurface nanoglistening, which is the whitening of the surface of the intraocular lens. Subsurface nanoglistening was first described by Matsushima in 2015. In June 2015, the JCRS had an editorial on the impact of glistenings on visual quality. The conclusion by Thomas Cohn was fairly disappointing. He said it rarely affects visual function. Nevertheless, in my practice, I see a large number of patients with significant changes in the lenses over time. This patient has 618 vision. She is 4 years post-op and had an alcon IQ implanted in an eye with uveitis. 4 years later, I have a blurry view of the fundus and I cannot image the macula with an OCT because of the intense glistenings in her eye. As I started seeing my alcon post-ops more closely, I noticed that many of them have a central discoloration also. Look at this patient. To the left we have the front of the lens, to the right the back of the lens. But look at the center. There is a distinct alteration in color in the center of this alcon lens. And this central discoloration is surrounded by a thin subsurface clear zone. In a month where I saw 76 post-op patients who had surgery with alcon IOLs in the previous 15 years, I noticed 15 of them had discoloration in their optic. Some are mild and some are quite distinct. The white alcon lenses have a white discoloration and the yellow alcon lenses have an yellow discoloration. The discoloration is seen in all models, the 3-piece, the single piece, the alcon torics and the alcon restored. This is a toric lens where you can see a distinct central optic discoloration. There is a subsurface clear zone in front and at the back. The peripheral zones are also clear. Two of my patients had a liquid after cataract, and you can see how the white after cataract looks yellowish due to this yellow alcon IQ lens. We can see the lens, we can see the liquid after cataract behind that, and you can see the subsurface clear zone there, and that's the milky after cataract. This patient underwent a YAG capsulotomy, and we can see the liquid after cataract draining into the vitreous in this photograph taken a few seconds after the YAG laser. Obviously, this person has more discoloration towards the anterior surface of the optic. So there are three types of opacification seen in aqueous of material: the glistenings, the SSNG, and optic discoloration. How should a normal IOL look inside the eye? Look at this lens taken with the same settings of the slit lamp 21 years after surgery. While the vast majority of alcon lenses are clear, some are not. We have seen glistenings in the eye, like the photograph on the left, And we have seen subsurface nanoglistenings like the photograph on the right. Here we see a few examples of optic discoloration in different acres of foldable lenses, most of them 2 to 5 years after surgery. The eye does not see what the mind does not know. I started looking out for stellate KPs only when I realized that these indicate that this patient has uveitis of probable infectious origin of viral etiology. Perhaps we should start looking at our alcon patients more carefully.